This video we'll discuss about aortic regurgitation. So this is a clinical condition in which normally as we see that the blood is pushed from the left ventricle into the aorta during systole. It regurgitates back. So blood pushed from left ventricle into aorta during systole regurgitates back into it during diastole due to inadequate closure of aortic valve leading to volume overload on left ventricle. Now coming on to the causes, that is the etiology. We'll divide it into two. One is congenital, another one is acquired. In congenital bicuspid valve, to remember the etiology for acquired, we will remember a mnemonic which goes in like rhythmness. So here we have rheumatic heart disease, infective endocarditis. By M we have Marfan syndrome, T trauma, dissecting aneurysm of ascending aorta. By A we have ankylosing spondylitis. From S we have syphilitic aortitis, and we have severe hypertension. Now after discussing the causes, we'll discuss the pathophysiology. Now what really happens is there is a backflow of blood into left ventricle. Okay, then there will be an increase in the left ventricular end diastolic volume, due to which there will be a compensatory myocardial hypertrophy plus left ventricular hypertrophy, matlab enlargement. So it maintains, initially it will maintain the systolic volume, it will maintain the stroke volume and cardiac output, but there is occurring two things. One is there is an increase in the left ventricular size. How it is occurring? By two mechanisms. First is that the ventricle apex is close to the chest wall. Due to this chest wall, and the second one is the excessive left ventricular stretching. Okay, in this what happens is we feel a pounding sensation. We also feel an uncomfortable awareness of a heartbeat. So this leads to a rise. Now in case when this happens, this leads to pulmonary congestion and dyspnea. Now coming on to the clinical features. In symptoms, what we see is palato mild and moderate, then we have severe. In mild to moderate, we will feel palpitations, then it is mainly asymptomatic. In palpitations you will feel like there is pounding sensation. Now in severe, we can see angina, pectoris, arrhythmia, then dyspnea, orthopnea, paroxysmal nocturnal dyspnea.